Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 8 homeopathic remedies for vitiligo. What is vitiligo? Vitiligo is a chronic autoimmune disease where skin loses its normal hue because of destruction of melanocytes and appears whitish. That is, skin appears whitish. Who attract vitiligo? Everyone, irrespective of sex, age, race, may attract vitiligo. About 50% of people, that is the people who gets this vitiligo, 50% of that will get it by before 20 years. And a section used to get that by their childhood. What is the nature of vitiligo? Depending on the sites where the attacking cell affect, one may have lighter spots, patches on skin, loss of color in mouth, nose, lips, which may spread around, may get change of color of hair, eyebrow, eyelash, mustache, beard, may lose color in eye, may get hearing loss, inner ear contains melanocytes. Eye also has got a second layer, that is called choroid. Choroid is full of melanocytes. So those are attacked by these immune cells. There is loss of color in eye also. Affection may be bilaterally symmetrical or unilateral too. Who are predisposed to vitiligo? Those having relative with vitiligo, those having other autoimmune diseases, relative having the same, those having melanoma or non-Hodgkin lymphoma, those who are receiving treatment of immunotherapy, those who have low immune power, like patients of cancer, diabetes, rheumatoid arthritis, lupus, etc. What are signs symptoms of vitiligo? Vitiligo may appear as milky white patches distributed sporadically over extremities, face, trunk of the body. White patches may appear in buccal cavity or in nostrils. Uveitis or swelling of eyes. Uveitis on the right hand side, lowermost picture is the picture of uveitis. Uveitis lies in front of the lens. Actually, this is the part of the choroid, second layer of the eye. So this contains choroid. This contains this color melanocytes. So these are attacked by immune cells. So there is inflammation of uvea. Thus uveitis results. Inflammation of ear. Already discussed that in the ear there are also melanocytes. Loss of self-esteem, particularly if vitiligo is visible. Loss of self-esteem is a mental symptom. When the patient has got this whitish patch, he thinks that he looks bad. He or she thinks that he or she looks bad. So they lack self-respect and self-esteem. That is particularly if this vitiligo is visible. If it is covered by dress, then it's okay. But sometimes it may happen that it occurs in a particular place which cannot be covered with dress or by other means. Then it causes loss of self-esteem of the patient also. What are causes of vitiligo? Autoimmune disease often run in family, as such hereditary factors like gene, etc. is involved. Damage of immune system. Is vitiligo curable? We know vitiligo is an autoimmune disease. In modern allopathic medicine, there is no cure, but management is there. They manage by some other way, sometimes using some chemicals, so that the skin is managed, the skin color is managed with this normal color. But those are very temporary type of treatment. In classical homeopathy, it is curable, but it may be challenging to both patients and physician. Treatment should commence with details of history of the patient to pinpoint the damage, to pinpoint how the damage to the immune system has come about, because you have to, doctor has to cancel that thing. I mean, he has to restore the immune system to normal before cure. It must be, the immune system must be restored to normal state. That is why it is challenging. It may take time for both patient and physician. Time, not only time, but a lot of patience also. So treatment should commence with details history of the patient to pinpoint the particular phenomena where or how that damage to the immune system has occurred. How can vitiligo be prevented? Please observe the rule to keep immune system intact. What are those? That I have given number 1, 2, 3, etc. in this way. Shun all addictions. Avoid too much of modern allopathic remedies. Dilute grief, pain, sorrow, mental stress. This is very important. Take enough green vegetables, fruits, fish, eggs, nuts, lentils, pulses. Avoid sugar, saturated fat and salt. Have some physical training daily for at least 20 to 25 minutes. Try to have deep sleep for 7 to 8 hours daily. Take water about 3 liters a day. These are for keeping the immune system intact. If you can keep your immune system intact, and if there is no chance of coming this particular disease from your relative, I mean in your family there is no history of vitiligo in earlier case, then you will completely prevent it. There will be no cause of vitiligo attacking you, because these are these points that I've given in just 1, 2, 3, 4, etc. These are very, very important thing to preserve the immune system. If you can do this, your immune system will preserve normally. There will be no suppression of immune system, and it will not, because see, immune system, how immune system is damaged, why it is attacking your immune system, is attacking your cell. Why? Because we have tortured, we have put damaging pressure on the system, so the system has gone out of order and now it is attacking its own cells. Unless the immune system is damaged or you torture him, it cannot get deformed. It deformed only when you give too much unwanted, unnecessary pressure on it. By this means, you're taking too much of addictions, you are taking too much of allopathic medicines, you had a lot of grief, you cannot take deep sleep night for months together, you do not take enough veggies, etc., etc. That's why actually these are normal things. If you can do this, your immune system will be preserved and there will be no attack of vitiligo, provided there is nothing familial trends in your family. If it is there in the family, then you have a lot of chance of being attacked with this vitiligo. Arsenic for vitiligo. Skin like parchment with white spots, burns violently, dry, scaly, shriveled, anxious, disturbed, restless sleep. Skin symptoms alternate with internal affections, psoriasis. Patients think they are vitiligo incurable, want to commit suicide, great fear of death, depressed, melancholic, indifferent. Natic acid for vitiligo. Vitiligo stricken area scaly, yellow with cracks and fissures. Splinter-like pain in every edge or corner of mucocutaneous junctions with exuberant granulations. Person take cold easily. Used to pass strong smelling urine like horse's urine. Patient desire for fat, indigestible substances like chalk, charcoal, dried mud, etc. Carbo animalis for vitiligo. Old persons of feeble constitution with low vitality affected with vitiligo. Over and above, skin studded with copper colored eruptions. Gland inflame slowly and get indurated. Go worse from truffle causes. Very susceptible to cold. CPR for vitiligo. Vitiligo with blotched and spotted skin, eruptions hard, rough, cracked. Affections on elbows and other flexures. Affection on elbows and other flexures. Ringworm works in every spring. Weak or empty feeling in epigastrium, chest, knees, sensation of fullness. Epigastrium is one of the region of the 9 quadrants of abdomen. The abdomen has been divided by 9 quadrants in clinical medicine. This is right hypochondria, left hypochondria, epigastric, right lumbar, left lumbar, umbilical, right iliac, left iliac, epigastric. So here it is epigastrium means this region. Now you may wonder, some of you may wonder that while discussing vitiligo, what is the importance of this apparently irrelevant thing? You see, nothing is irrelevant. Homeopathy, mind this, homeopathy treats patient, not the disease. So you must pinpoint the particular person. Vitiligo is a fixed thing. Loss of normal skin color, that is vitiligo. So that if you say think in this in this way, you cannot give medicine, because there are in homeopathy there may be 50 medicines, 50 medicine for vitiligo. Now how will you pinpoint? You have to pinpoint the person. Homeopathy treats a person, not a disease. So for determination of the person, these symptoms are extra symptoms are needed. You cannot go by only vitiligo. So you are trying to give a medicine for diarrhea. For diarrhea, there may be 80 medicine in homeopathy. 80, as many as 80, maybe more than that. But you have to pinpoint the particular person. That's why this type of other symptoms always are considered in conjunction with the disease. The disease symptoms is less important. Most important is the persons. Marks for vitiligo. Vitiligo with constant moist skin. Look this. Constant moist skin, eyes, teeth yellowish, tender, excoriated. These are generalizations. And vitiligo with constant moist only. Tongue thick tongue, flabby, imprints of teeth on the edges. Perspiration oily. All secretions, that is all secretion of marks for patients from body thin, slimy, acrid, burning, foul or thick, greenish, yellowish. Sulfur for vitiligo. What is vitiligo with dry, scaly, voluptuous, itchy, burning skin? Works in warmth of bed at night. Vitiligo starts after a suppression of skin disease, excoriation in folds, burning when scratched. All orifices like nostril, mouth, anus, etc. are red. Patients hot, like to stay bare-bodied. Suriname vitiligo. Itching vitiligo which gets worse in every winter. Skinny oil, greasy, scabby. Maniacal washing on hands and feet very often. Patients are very chilly, wear warm clothes even in summer. Tuberculinum vitiligo. Vitiligo persons who fear animals, especially dogs. Narrow-chested persons get cold easily from slightest exposure. Changing moods, symptoms always. That is, changing of moods and symptoms are always there. Eruptions on face, chest, neck, mostly. With this, the video ends. Thanks for listening and viewing. If you got any problem, please write down in the comment section. I will respond certainly.